Hi, everybody. Hi, this is Dr. Ken Muich, Fibromyalgia Wellness Center. And just kind of a review of what we've been talking about the last couple of weeks, and that is to put the whole fibromyalgia treatment program together for you. But I want to mention something, and I mentioned this and I wrote about it in my book, Fibromyalgia Falsehoods, Fakers, and Facts, still available, Amazon and so forth, because it tells the whole story. And the one thing that I found was this is not a take-home type of a treatment. Part of it is, yes, okay, under the auspices and treatment and control of the doctor that is trained in our program. And we do have doctors that are trained throughout the United States, but it's very difficult sometimes to find them, especially in certain areas. The bottom line is that you need someone to go over the program with you and guide you, especially for the amount of guaifenesin and the various other things as we go through them. I'll explain them to you. The program is involved with two different parts. One is called the pre-protocol, and fibromyalgia patients have an inflammatory reaction going on, and they have a very poor dietary area, no exercise. So even if you haven't gained weight, if you don't exercise, there's a certain amount of fat that is accumulated not only between the tissues, but also in and around and amongst your organs. So what we do is we do an anti-inflammatory detox program for you. It's very, very simple, really. We're going to take things out of your diet that are causing an inflammatory response that will block our program from actually taking place. And it's also going to help the secondary conditions that you have. And every one of you have secondary conditions. Working with fibromyalgia patients since 1990, I've not found one fibromyalgia patient that just has fibromyalgia. You have other conditions that oftentimes mimic fibromyalgia. There's about 15, as I mentioned to before, osteoarthritis, rheumatoid, lupus, Lyme disease, hypothyroidism, hypoglycemia, so forth and so on. So this is all very, very important that you understand what we're trying to do is get rid of all that secondary garbage so our program works, and also probably in many respects reduces the other secondary conditions. So the first thing we do is we put you on a restricted hypoglycemic diet. Dr. St. Amand found that about 40% of all fibromyalgia patients have hypoglycemia, and so if we don't put you on this, then it's really not going to work. But anyway, restricted hypoglycemic diet, we're taking out anything that would be inflammatory and oftentimes addictive, like sugar, gluten, trans fatty acids, and dairy. How long? Forever? No. About 2.5, 3 weeks. Okay, you have to take it out of your system before you add it to find out if you have a bad reaction. Along with that, we place the patients on omega-3. Omega-3 is very, very important for two aspects. EPA, eicosapentaenoic acid, which is a natural anti-inflammatory. DHA, docosahexaenoic acid, which is a brain stimulant. Both of those are very, very important for fibromyalgia patients. Patients on magnesium. That's very, very important. It's a stimulant for the mitochondria. You have already batteries in your body that produce ATP. Also, malic acid, which again is a natural anti-inflammatory. So many of my patients have osteoarthritic conditions, and malic acid is just great for the joints itself. Conjugated linoleic acid. Conjugated linoleic acid burns fat off your body if you exercise or not. That's very, very important because as you're going through this program, when you start feeling better, your body's already burning fat off of your tissues and your organs. We've had patients that have lost 20, 30, sometimes 40 pounds once they get on this. So you're on this for about 2.5, 3 weeks. And then what you do is you add one food off that restricted diet every 72 hours or every 3 days. You want a steak? Great, eat it. You want butter? Eat it. You want eggs? You want milk? You want whatever that's restricted on there. If you want to eat a muffin, you want to eat something, bread, whatever. You want to find out what kind of reaction you have, but only one item every 72 hours to find out what kind of reaction you have. And we give you a sheet that says, okay, what happens after 15 minutes, after 1 hour, and then 72 hours. Why? Because some products may not have an immediate effect on you, but they may block you from evacuating, or they may cause diarrhea. And many fibromyalgia patients already either have diarrhea or constipation, so you can have a reaction oftentimes when you have this at the end of the 72 hours, so to speak, or at the end of this time. So that's the pre-protocol. So you're going to be taking, in other words, these foods. One, and again, I'll give you the sheet so that you can mark off different things. You'd be surprised how many patients come in and say, "Gee, I can't believe I couldn't have this, I couldn't have that. I can't believe that this is causing so much of a problem in my body." At that point, then you got a choice. You eat it and you stay sick, or you stay off of it. Yes, it's a sacrifice, okay? You got to look at this like it's you've got diabetes. Diabetic people, if they have some foods that they know are bad for them, they're going to have a reaction, okay? Maybe even end up in a hospital. And you don't want that. If this is one of these programs that you have to be sick and tired of being sick and tired. And this is going to help you. It really will. So that's the first part of the program. We're getting rid of the secondary garbage out of your system so that the real program actually works. The second part of the program involves Dr. Saint Amand, and he's an MD. He also not only has his practice, but also a researcher out of UCLA. And he has fibromyalgia. He's 88 years young. And he had to find an answer to help him so he could help his patients. And in his research, he found that there's genetic mutations, and this has been validated in other researchers that find that fibromyalgia has genetic mutations. And what the mutation is, they're still looking for the specific genetics itself, but what it causes is an excess amount of phosphate and calcium to build up in the cells. What that is what the problem is with that is phosphate burns out, the excess phosphate burns out the mitochondria, the ever-ready batteries, for producing ATP, adenosine triphosphate, which is your energy. Look, I'm moving my hands. That's required ATP. I'm talking ATP. I'm blinking. I'm making facial various reactions and so forth. Those are all ATP. Anything you're breathing, all of your organs, they're all dependent upon adenosine triphosphate. And if it burns out, not only is there a fatigue factor, but there's also an immune deficiency, so you're much more susceptible to a lot of other health problems. The other thing is calcium, excess calcium. You might say, "Gee, calcium, that's great. I'll have bones of steel." Well, not really. If it stays in the cells, what happens is that calcium, a lot of people don't realize, is a muscle stimulant. So for fibromyalgia patients, your muscles are constantly at a state of activity, which causes a lot of fatigue, okay, immune deficiency, and if your muscle are constantly at a state of activity, you don't get deep REM sleep. Why is that important? Your body heals and your tissue heals on deep REM sleep. If you don't have deep REM sleep, then even minor accidents and injuries and so forth take 2-3 times as long. Automobile accident patients that come in to have fibromyalgia, the usual customary, 8 to 12 weeks might be 3, 4, 5 months for them to actually get back to some stasis of health itself. So that's why you have to understand what is happening to your body and why you're having so many different symptoms. Okay, excess phosphate and calcium are causing those reactions and problems. Well, Dr. Saint Amand found, hi Pamela, good afternoon. Dr. Saint Amand found that in his research that a very innocuous, very, very safe substance called guaifenesin, okay, pulls the excess phosphate and calcium out of the cells. You urinate it out. That's great, okay? Well, a couple things. Number one, you have to know the amount that you have to take. And two, there's a blocking agent. You have to stay off something called salicylates. And the next program that we're going to be talking about are specifically salicylates. Look, anything as a salicylate is a plant. Salicylates are its defense, so to speak. There are certain bugs and so forth that don't like salicylates, so they stay off of the plants and they don't eat them, and that's how the plant is able to survive. Well, salicylates also blocks this called guaifenesin, okay, from actually working. By the way, guaifenesin, it's very, very common. It's been in the market for, decades and more. Guaifenesin is used as a medical reason to break up congestion in your lungs. So you can expectorate, you can cough it up, so to speak. A lot of people, if you watch television, I'm sure you've seen ads for Mucinex. That's guaifenesin. That's what it is. But you don't want to use that because it's not pure, okay? And I'll be getting into that in just a few moments. But anyway, bottom line is guaifenesin pulls the excess phosphate and calcium out, but you have to stay off of salicylates. You have to stay off of salicylates because it blocks it. So what are salicylates? Again, anything that's plant-based. You can eat whatever you want to within certain restrictions, and we actually give you sheets of paper that show you, okay, you can have 2 cups of this or unlimited this, so forth and so on. Why? Because the liver actually processes all of this, and if you have an excess amount of salicylates come in, it may not be advantageous for you, and it may block the guaifenesin from working. So all of those things are extremely important. But salicylates are things that you just take for granted, as a matter of fact. Now, again, you can eat foods because the liver will actually process it and break it down. But think of all the salicylates that you have around you. Most toothpaste, peppermint, spearmint, those are plants. You can't have those, okay? You have to find a toothpaste that does not have that in it. And there are a lot of products that are. How about the aloe for your hands, okay? You can't have that. How about all of the products that women place on their face and men, aftershave lotions and the products that you actually put on for makeup in itself. Those are usually plant-based, but there are salicylate-free products out there. Matter of fact, made specifically for this protocol, believe it or not. So you're not stuck with, oh goodness gracious, I'm not going to be able to put anything on. I won't be able to put any of my makeup on, so forth and so on. No, that's not true. We guide you into that direction. So how much guaifenesin do you take? Well, 300 milligrams to start, okay, twice a day, 300 milligrams twice a day. What we have for patients is 100% pure guaifenesin. And so it doesn't have anything, doesn't have any salicylates because like Mucinex, they have their products are encapsulated, and the capsule itself has some salicylates based on it, so you can't do that. Just very, very small things. We're constantly testing everything that we can. So another thing that is important, along with the guaifenesin in our program, is what's something called mapping. The excess phosphate and calcium builds up lumps and bumps and fluid-filled areas under your skin. So we actually, doctors, those that are trained in this, actually do mapping on the patient to find out where these are. We place them on a picture, and we do this on every visit so the patient can actually see improvement as they go along. I've had patients that literally have to use up all the ink on a pen to write them down, but by the time their treatment program is just about over, you can find hardly anything on them because the excess phosphate and calcium is gone. It's pulled out of your body. By the way, the excess phosphate and calcium is in cells throughout your body, not just on your arms and legs, okay? But the mapping is important because we actually map your arms and your legs, any areas that really are, for the most part, are uncovered, maybe the neck and so forth, but we don't go into the other personal areas in itself. So the mapping is extremely important. Also, a very objective test, very totally objective test, and that is to find out, it's the only place where we really look for pain on the body, and that is the left leg, the left front leg, lower leg of the body, where we actually run our hands up and down from the hip bone to the medial knee to find out if there's any tenderness involved. If there is, that means that the guaifenesin still is not working. You probably have to increase it. But you know, I run into patients that have tried this program. They're maybe taking 3,000, 4,000 milligrams of guaifenesin that without actually knowing the amount that you need to take, and under trained supervision like myself and some other doctors, you're going to be taking a lot of guaifenesin that might actually have a bad reaction for you. So it's extremely important that you understand that you have to do this under the auspices and training of a doctor that is actually trained in our program and protocol. So that's it. Well, Dr. Seidemann said like 1 month for every year that you've had it, so forth and so on. I find that for those patients that are really strict on this program, it usually takes anywhere from 3 to 6 months, and that in itself is extremely important. During that period of time, you are improving, and I've had a lot of patients that have gone 3 months and bango, man, they're living a normal life. They're skiing, they're exercising, they're back to work, so forth and so on. The level of severity has really nothing to do with how quickly this works. It could work for somebody that has a mild form of fibromyalgia that really hasn't gone into excess, or it can also work for somebody that comes in that's extreme. We've had it in both cases itself. So that's the basis of our program, the pre-protocol, and then the guaifenesin mapping and some other areas that we actually have and the staying off of salicylates itself. But again, you can't do this by yourself. You have to really have someone to help guide you through this so you know exactly how much you take, show the improvements, so forth and so on. This is Dr. Ken Muich, Fibromyalgia Wellness Center, where we are, about 18 minutes. It's perfect. Next week, where we are finishing this part of the program, don't be afraid to ask questions. I've got some people actually out of state, out of country. I've got one lady that I'll start working with, the United Kingdom, that's Britain. And so we can help you long distance because a lot of these programs are already taken. Your protocol works, Pamela. Thank you so very, very much. I'm so very, very happy to hear that. That's great. If you have any questions, please feel free to get in touch with me. Phone number is 480-948-4955. That's in Arizona. You can also get hold of me, email dcken2000@cs.com. That's D as in dog, C as in cat, Ken, K-E-N, the number 2000 at C as in cat, S as in Sam.com. Thank you so very, very much. Next week, we're going to go into more detail about salicylates and a few other things. And Pam says not only does the protocol work, but she's back to work itself. I'm so very, very happy for you. You're blessed with this health, and that's the most important thing. Thank you very much. I'm so happy to hear that. Take care, everybody, and lots of love and blessings to each and every one of you. Thank you so very, very much. Bye-bye.